Welcome back to MedBites. We're going to talk about refeeding syndrome. This is not a high yield topic, it's very niche, but it does show up and it has showed up a couple times in medical school and board exams, and people do tend to get it wrong, even though it's a pretty easy concept to understand. So, refeeding syndrome is basically a crash in phosphate levels when you give a patient that's starving IV dextrose or IV glucose, which results in a spike in insulin. When the IV dextrose is given in a starving state, the cells suddenly decide to create a lot of ATP because they're starving, and that glucose and the insulin spike will promote that. And the creation of ATP requires a lot of phosphate. So it's ADP plus the phosphate that gives you ATP. This sudden high use of phosphate results in a crash in phosphate levels. When those serum phosphates crash, they result in muscle weakness, arrhythmia, and respiratory failure, which can result in death. And it's important that you fix electrolytes before giving dextrose. Let's go over a question real quick so we can really hammer down this concept. Let's say that we have a 50-year-old patient with a history of chronic alcohol use that comes to the ER with altered mental status. So the moment you see this part of the question, the first thing that should pop into your mind would be Wernicke's Korsakoff. But the question's not done yet. It says that we give the patient thiamine and IV dextrose. After a few hours, let's say 3 hours, patient has muscle weakness. Labs show serum phosphate concentration of zero point 0.5 milligrams per deciliter. Normal range would be somewhere around 2.5 to 4.5. So we know that it's low. What caused it? The cause would be a big shift of phosphates into the muscles because those muscles are going to create the ATP. So if this question is given, the options that you would get would be something like, I don't know, kidneys are not resorbing phosphate, so they're wasting the phosphate, you're urinating it out, or something else like, um, what else? Oh, yeah, bones are taking up uh, the phosphate, things to throw you off, but are physiologically correct because, calcium binds to phosphate, kidneys can get rid of phosphate, these things that make you double think what's going on. But in reality, what's going on is that the muscles are taking up all the phosphate to create ATP, and that's really what's causing the crash in phosphate. So I hope that was clear. It's really not that hard, and hopefully you'll nail this question anytime you get it.